Malaria is a global health crisis, a disease of poverty infecting millions of people and every year taking more than 600,000 lives, mostly young children and pregnant women in sub-Saharan Africa. Every 60 seconds, a child dies of malaria. But malaria is 100% preventable. A comprehensive public health effort virtually eradicated malaria in the U.S. more than 50 years ago. As a result, most people in our country have little awareness of the suffering and misery still caused by malaria in the 21st century. But United Methodists across the world and in North Georgia, in partnership with international organizations and local communities, are working to eradicate malaria from the planet. In 2006, Nothing But Nets, in partnership with the United Nations Foundation, began a major campaign to fight malaria by distributing bed nets in affected areas. The United Methodist Church was invited to become a founding member. As effective and essential as bed nets are in this life and death struggle, we soon realized more was needed. In 2008, following up the success of Nothing But Nets, the General Conference approved a more comprehensive approach to malaria education called Imagine No Malaria. With the help of grants from the Bill and Melinda Gates Foundation and other international health organizations, Imagine No Malaria has focused on the most critically affected regions of sub-Saharan Africa. Imagine No Malaria is an integrated plan of action focusing on 4 key areas: prevention, education, communication, and treatment. In support of this effort, we are inviting 11.5 million United Methodists worldwide and 350,000 in North Georgia to help empower a continent to eradicate malaria. Building on the success of Nothing But Nets, Imagine No Malaria continues to focus on the simple, cost-effective, and highly successful use of insecticide-treated mosquito nets.
When I'm under this net, I'm protected from mosquitoes. So since I was given it, I have taken 2 years without fever. Even my children, nobody of them has ever suffered from malaria.
These nets are still the best way to prevent malaria. Other measures, however, like draining standing water, trimming foliage, and promoting proper sanitation are also critical. Imagine No Malaria trains community-based volunteers to teach about malaria, such as identifying symptoms and dispelling myth. Education is critical to support the changes in behavior that are necessary to stamp out malaria. Community health workers instruct families why it is critical to sleep under a bed net and how to properly care for this life-saving tool.
When you're a believer, when you know God, everything becomes possible. Knowing that we are going to do work. At the first time, we even hesitated, but we thought of what God did to the people, of what Jesus did to the people. But we said we should voluntarily work to the people to get the souls of believers, of the people in the community, also to be adopted in the house of God. And we are doing it in God's name, and we are not tired of it.
United Methodist Church today operates hospitals, clinics, and health posts across the African continent, all part of a comprehensive program to fight this killer disease. Increased malaria prevention and control measures are dramatically reducing malaria in many places. But those hospitals need rapid diagnosis kits and life-saving medicines to treat people who have contracted the disease. Imagine No Malaria equips local communities in all 4 key areas, training local health teams and partnering with other international institutions and churches. Here in North Georgia, we have been actively engaged in the fight against malaria since 2008. And our conference's gifts have helped provide a major boost in the battle against malaria and to expand our reach in East Africa. At the 2011 session of the North Georgia Annual Conference, we received an offering for Imagine No Malaria and designated it for Uganda. This past December, a delegation from North Georgia, Imagine No Malaria, and UMCOR went to Uganda to verify that these funds were appropriately dispersed. In partnership with the Indigenous Church of Uganda, we witnessed health clinics, net distribution, community health teams. We saw firsthand the power of our gifts, prayers, and involvement. The Imagine No Malaria effort helps us realize the best of who we are as United Methodists, putting our faith in action, healing the sick, and helping those in need. Matthew 10:8.
We saw how all the money that is given towards education, towards communication, towards efforts of prevention and treatment, how that is actually changing the lives of people every day in Uganda. We visited with leaders of the Church of Uganda. We visited with people in villages throughout the country. We visited with medical workers and medical teams. We visited with hospital personnel, people who are making efforts to educate people in local villages about how to end malaria. I feel like that's one of the ways that we in North Georgia can continue to be the hands and feet of Christ, actually living out and practicing what's in our scriptures that teaches us about pooling our resources together, chipping in to make a real difference in needs in our community, and not just in our local communities, but in our global community.
Our efforts are making a huge difference. Imagine No Malaria is active in 16 countries in sub-Saharan Africa. Through these efforts, 13 national health teams have been organized to oversee and carry out work. More than 11,000 volunteer workers have been trained, and almost 2 million nets have been distributed. In 2008, the General Conference set a high goal of raising $75 million for Imagine No Malaria to save 7.5 million lives. To date, we have raised more than $62 million, equating to more than 6.2 million lives saved. We are called to do more. The fact that millions of people will die this year from a fully preventable and treatable disease is not satisfactory. United Methodists have always responded to suffering with love, compassion, and action. Through Imagine No Malaria, we are showing the world what can be accomplished and how disciples of Jesus can transform the world. 45 annual conferences are now engaged in this fight. Our goal of raising $75 million is in sight. Now the people of North Georgia have the opportunity to help us cross the finish line. Our goal is to eliminate malaria on the African continent by 2015. Every one of our North Georgia churches can help. Each individual United Methodist can help. Between now and next year's annual conference, here is what we can do. Donate. $1, one member, one church at a time. Text to give malaria to 27722. A $10 donation saves one life. Educate. You can learn more. www.ngumc.org/Imagine No Malaria. www.imaginenomalaria.org. Advocate. Tell others the story. Start an Imagine No Malaria mission in your church. We are in this fight, and with sustained effort, we will win it. Together with United Methodists worldwide, North Georgia United Methodists can save millions of children's lives, making sure that these smiling faces see a bright future. Let's make this year the one that North Georgians help the world imagine no malaria.